Good afternoon, everyone, and thank you for joining us this afternoon. Our presentation is going to be on a collaborative approach to youth homelessness diversion. My name is Elena Westervelt, and I am the project coordinator for the Community Youth Housing Project, of which the Diversion Project is a part.
And my name is Julia Verbitsky. I'm one of the diversion case managers based out of Catholic Children's Aid Society.
And my name is Erin Sokolowski, and I'm the Adolescent Team Protection Supervisor at the Catholic Children's Aid Society of Hamilton. A significant area of focus on our team is our support of youth who are at risk of ejection from their homes due to conflict with caregivers. This issue has been more prevalent since 2017 when the Ontario age of protection raised from 16 to 18 years upon the introduction of the Child and Youth Family Services Act. Therefore, my participation within the community youth housing project seemed like a natural fit. The origin of our project dates back to 2002, when a group of like-minded and motivated frontline and management staff employed by various youth-serving agencies joined together to determine how to better serve our Hamilton street-involved and homeless youth. This group was an opportunity for service providers to share information, learn from each other, and better understand the Hamilton landscape while discussing trends and opening lines of communication. In 2004, when director Andre Casabon arrived in Hamilton and released a documentary sharing the experiences of youth leaving the child welfare system with little support and no one to meet them on the other side, this spurred the group to shift from just talking about the issue to moving into more action. The group, now named the Street Involved Youth Collaborative, joined forces with the Social Planning and Research Council of Hamilton, who authored and released their report addressing the needs of street-involved and homeless youth in Hamilton in 2005. 27 recommendations later, and with the strong support of the Hamilton community, along with government-funded resources supporting this initiative, the early stages of the Youth Housing Support Project came to fruition, and most importantly, a group of youth with lived experience acted as consultants and helped guide the professionals to ensure that the work we were doing was in line with the needs of the group we were trying to serve. One recommendation of the report encouraged the development of a partnership between the community and both child welfare agencies in Hamilton. This led to the creation of the Housing Youth Leaving Care Project, which provided wraparound supports for youth who are exiting care with the help of aftercare workers and access to transitional housing options. Learning during this time also created a heightened sense of awareness of the successes associated with networking, partnership, and communication between agencies who are at times competing for the limited amount of funding being offered to serve our youth population in need. As funding criteria evolved and changed, so did our project. The Youth Housing Support Project soon became a partnership with 5 Hamilton-based agencies working together to support youth between the ages of 16 to 25. It consisted of 3 program tiers, one of which included the Early Intervention Program. Within the EI program, case managers were connecting to youth 24 to 48 hours within their arrival to shelter, with the focus to provide emotional support, access to external services, and referrals to transitional housing options. This approach and subsequent success of this project was based on evidence which showed that youth would be less at risk of entrenchment in the street-involved youth culture if they were provided intervention at the earliest opportunity upon their experience of housing instability. The project officially launched in April 2015, and for the first time, 4 temporary off-site beds located at Wesley Youth Housing were also offered as an alternative place to stay from shelter when youth were in transition and returning home or moving into independent housing. Family conflict, mental health, and addiction concerns were the main reasons for youth to seek out our support, and about 1/3 of the youth we served also experienced past or present child welfare system involvement. Our team shifted and changed once again due to funding criteria, and in April 2020, right when we were in the middle of a COVID lockdown, the Community Youth Housing Project came to life. Our team launched the Diversion Program, drawing from the philosophies of the Housing First for Youth, taking on a more proactive and not reactive approach to addressing youth homelessness, while emphasizing the importance of immediate access to housing with no preconditions, youth choice and self-determination, positive youth development, individualized and youth-driven supports, involvement of family and natural supports. Our diversion team serves youth aged 16 to 24 years of age who've been couch surfing and or experiencing family conflict and are experiencing their first time accessing the shelter. Our team includes 24/7 diversion support offered by the Good Shepherd Notre Dame shelter staff and 3 frontline team members, which include a systems caseworker based out of the Catholic Children's Aid Society of Hamilton, supporting youth who are or have been currently involved within the child welfare system, mental health system, or justice system. A community caseworker based out of the Wesley Youth Housing Program, accepting referrals from youth, families, schools, and other community partners. And our shelter caseworker based out of Good Shepherd Youth Services, who connects with youth accessing shelter service. Our project coordinator through the Social Planning and Research Council of Hamilton supports us with the collection of data, acts as a liaison between the frontline and management steering committee, and provides support to ensure we stay on track with our commitments and goals outlined in our project proposal to funders. And here are our partner agencies currently working within the project.
I'll be talking a little bit more about the Diversion Program, which was designed to prevent youth from becoming homeless and street involved, or very quickly, or as quickly as possible, supporting them in transitioning out of homelessness. We know that within a short period of time, as short as 24 to 48 hours, young people can become street involved when accessing shelter. We also know that there's considerable harm and trauma that's associated with even short episodes of homelessness, and that a lot of young people who are accessing the shelter already are experiencing mental health concerns. And we also know that most of the youth that are accessing our program and have in the previous programs in the past are experiencing family conflict at that time, or were recently experiencing family conflict. And so because of what we already know and what we have learned from the previous program, we are focusing on wanting to transition from an emergency response, which is what we were used to doing before, into geared more towards focusing on prevention, and then making sure that the young people and families that we're working with are supported with the supports that they need and the services that they need ongoing, even post being connected with our team. Not all of our referrals are coming directly from the shelter. Some are coming from the community. However, when there is a connection made to the shelter, this would look like either a phone call by the youth themselves or a family member, or a young person directly accessing or trying to access the shelter. In the past, young people, if there was a bed available, they would be welcomed to access the service. But now there's staff that are verifying whether where they're coming from is an option where they could temporarily stay, or if they could be supported in being referred to the diversion program, where they could get the support that they need to be stable and continue staying at home. So after that verification is made, many of the young people are actually returning home with a diversion referral completed. And when necessary, or if they cannot return back home, they are accessing one of the diversion beds that our program holds for young people to use on a temporary basis. And a very big part of our work is to support with family mediation. So when clients are accessing our program, usually the first, what we've learned is that it's very effective to reach out to family members and introduce ourselves and what the program is all about, while also being an ear to hear their concerns, because these parents and families are also struggling with their young adolescents at home. So it's about establishing relationships with everybody who's involved, and not siding with either the young person or the family members, but being a neutral and balanced support for everybody involved. And this is an opportunity where we can educate family members on the risks that come with street involvement and shelter access. Following some of that relationship building and education is when family mediation is offered. And it's during a family mediation session that we can identify the issues that are being experienced in the home, and then work towards working through those issues together within the 6-month period that we work together with the young person and family.
So where has this all brought us? Over the past year, we worked with 126 youth, of whom 86 were formally connected to a diversion case manager. As you can see, of those that were connected to a diversion case manager, the majority disclosed experiencing family conflict or mental health concerns as part of the reason why they were seeking to access shelter. 12 youth who were a part of the program accessed diversion beds, like Julia mentioned earlier, allowing them to avoid having to stay in shelter and to continue to work with a case manager towards a housing plan, whether that be to return home or to live independently. In total, 81% of the youth that were connected to the team achieved housing placements, with 58% of youth returning home with the appropriate supports. All of this led to a shelter diversion rate of over 55% for the youth sector. Some key lessons that we've learned along the way. The first is that it doesn't happen overnight. As Erin mentioned, the groundwork for this collaboration started in the early 2000s. And since then, there's been constant learnings about how we can best serve youth. Although our focus has shifted to explicitly be on youth homelessness diversion in 2020, the years of early intervention work that preceded the current iteration allowed us to incorporate what we learned along the way. We know that each organization involved brings a unique perspective and approach to youth homelessness diversion, and although at times this can create challenges, our work with youth is better because of it. This past year, COVID has reminded us of the need to constantly be flexible, to keep communication lines open between partner organizations in ways that look very different than they have before. And most importantly, to challenge ourselves to try new things to work with youth and their family towards the best possible outcomes. The second key learning is that community connections are critical. As much as the partners in the collaborative are important to how the diversion program functions, we would not be able to do the work that we do without the support of the broader community. As a light touch, time-limited program, it is crucial to connect youth and their supports with community organizations that can provide ongoing support to the youth and to their families. The Street Youth Planning Collaborative that Erin mentioned before has and continues to serve as a crucial avenue to support referrals to other community-based services. And the clinical supports that we are connected to through Good Shepherd and other community organizations allow our case managers to focus on their work with youth and their families and natural supports. I would be remiss not to mention that collaboration can be incredibly challenging at times, but working through the challenges has almost always led to efficiencies and to better outcomes for the youth that we serve. Being part of a collaborative where different organizations and their different approaches fuse together to find common ground in supporting young people and their families in Hamilton has promoted partnership and growth for all involved. And it has led to program changes that mean we are better able to walk alongside youth and their families as they access the program. One of the things that has been crucial for our team to do this work is training. So here are just a few of the focus areas for training that we found to be incredibly beneficial. Thank you for joining us. If you have any follow-up questions that we don't get to in the question and answer period, or want to connect about any of the resources that were mentioned during the presentation, please reach out. My contact info can be found on the slide.